Hello. Do you experience severe abdominal pain after eating fatty foods? It could be a sign of gallstones. In this video, we'll explain all about them. What are the symptoms of gallstones that you should be aware of? I'll also talk about what causes gallstones, whether gallstones are dangerous, whether there's a way to avoid getting gallstones, and whether there's a natural treatment that eliminates gallstones. But first, like the video and subscribe for more health tips. And tell me where in the world you're watching from. And write in the comments below. Let's go. First, let's talk about the gallbladder. What does the gallbladder do? The gallbladder is a small pear-shaped organ that lies just below the liver on the right side of the abdomen. It stores the bile that is produced in the liver, and when you eat, your gallbladder contracts and empties this bile into the small intestine to aid digestion. Bile is a liquid produced by the liver that contains cholesterol, among other substances, and helps to digest fats and absorb some fat-soluble vitamins. If your liver excretes more cholesterol than your bile can dissolve, this excess can turn into crystals and later into stones. Also, if your gallbladder doesn't empty completely or often enough, so it's a bit lazy, the bile will become too thick, concentrated, which can contribute to the formation of stones. So what are gallstones? To better understand the formation of gallstones, compare it to sand in a river. If the water doesn't flow well, the sand accumulates and forms stones. The same happens in the gallbladder when the bile doesn't flow properly. And these stones can range from the size of a grain of sand to several centimeters, even the size of a golf ball. There are people who have just one stone, and others who have several stones, literally a quarry, at the same time. Secondly, the National Institute of Diabetes and Digestive and Kidney Diseases estimates that between 10% and 15% of the U.S. population has gallstones. This means that gallstones are a common health problem in the United States, which corresponds to around 25 million Americans. Around a quarter of the almost 1 million people diagnosed with gallstones each year will need to be treated, usually with surgery. And these conditions are more common after the age of 40, and women are approximately twice as likely to develop gallstones compared to men. What are the types of gallstones? Two main types: cholesterol stones. The most frequent, more than 75% of cases, are yellow stones. And the second type are pigmented, black or brown stones formed by bile pigments, when your bile contains a lot of bilirubin. What are the symptoms of gallstones? Many people have no symptoms, so they may not know that they are carrying a stone inside their gallbladder. You yourself may have a stone and not know it because you've never felt anything. What are the symptoms? Look out for pain in the upper belly, usually on the right, just below the ribs, which is where the gallbladder is. Or just as often, a pain in the right shoulder or a pain in the middle of the back between the two scapulae. Nausea and vomiting, indigestion. Heartburn, yellow skin, yellow eyes. Your urine is dark and your stools are light. Fever and chills may indicate an infection. Some risk factors for gallstones you can't change, such as your age. The risk increases after 40, female gender and family history. If someone in your family has had gallstones, you're more likely to develop them too. But the good news is that there are many factors you can control. Obesity, a high-fat, low-fiber diet, a sedentary lifestyle, and high cholesterol increase the risk. Losing weight too quickly can also be a factor. Maintaining a healthy weight, exercising, and eating a balanced diet are great forms of prevention. Diabetes, pregnancy, contraceptive use, hormone replacement therapy, inflammatory bowel diseases, and hemolytic anemia can also play a role, but the main focus here is on the factors you can change in your daily life. How are gallstones diagnosed? A simple ultrasound scan of the upper abdomen can tell. Of course, it can also be diagnosed with a CT scan, MRI, or even an X-ray. What is the treatment for gallstones? There are no proven natural treatments for gallstones. Always consult a doctor. Some people take various types of tea to eliminate them, such as peppermint tea, ginger tea, and chamomile tea. No tea will eliminate your gallstones, and neither will meditation. When it's indicated, if you've already had symptoms of gallstones, the most recommended treatment, the one that works, is surgery to remove the gallbladder. Nowadays, the procedure is very quick, lasting less than an hour, and requires 1 or 2 days of rest, with full recovery taking around 14 days. Yes, it is entirely possible to live without a gallbladder. With a few adjustments, you should avoid eating too much fat or too much fiber, as the body will have difficulty digesting it, which can cause diarrhea and a lot of gas. After a while, your body gets used to it and you can live normally. Just don't overdo it with the fat. But if you have no symptoms or your doctor hasn't recommended surgery, you don't need it. This means that the doctor will monitor your symptoms to see if they progress before treatment is considered. But you should keep an eye out for any symptoms. And what are the complications of this gallstone? If a gallstone comes out of the gallbladder, it can block the bile duct, which is like a pipe that carries bile to the intestine. If this pipe gets blocked, the bile can't pass through, causing a problem called cholecystectomy. This can lead to more serious complications, such as inflammation of the gallbladder, cholecystitis, or even pancreatitis, which is inflammation of the pancreas. In fact, gallstones are the main cause of acute pancreatitis. Another complication is cholangitis, an infection of the bile ducts caused by bacteria that proliferate when bile becomes stagnant. It's rare, but gallstones can increase the risk of gallbladder cancer. To help prevent gallstones, maintain a healthy weight, exercise regularly, follow a balanced diet rich in fruit, vegetables, and whole grains, and avoid very restrictive diets that lead to rapid weight loss. Did you like the video? Leave a like, subscribe to the channel, and share it with your friends and family. And don't forget to leave a comment below telling us about your experience or questions on the subject. Want to keep learning about health? Also watch these videos: 5 forbidden foods for fatty liver and 10 best fruits for hepatic steatosis, and my playlist on diabetes, one of the most complete on the subject. Thanks for watching. May God bless us with health and life. Let's work together to promote everyone's well-being. Subscribe for more health videos.